Life's journey can get rough on all of us, and maybe you are looking for a safe harbor. Well, Cove Behavioral Health's mission is to support the community's overall wellness by providing accessible and compassionate behavioral health care. From mental health to also substance abuse disorders, their trained and skilled clinicians can be a safe harbor. Erica Brisky joins me now, Director of Medication-Assisted Treatment Services from Cove. Welcome, Erica. How are you?
Thank you so much. I'm so happy to be here. I'm doing well, thank you.
Good. Well, let's dive right in. Medication-assisted treatment. I feel like it's one of those things that, sometimes we've heard about. If you're not directly impacted, maybe you've got some questions on what it is and really how it makes Cove stand out.
That's correct. Medication-assisted treatment, it is the use of medication in combination with counseling and behavioral therapies to provide a whole person approach to treatment. It is evidence-based and it has been around saving lives in our communities for many years. At Cove Behavioral Health, we offer medication-assisted treatments to individuals with opioid use and alcohol disorder, as well as psychiatric disorders. Some of the stigmas that may come into play when speaking about MAT and if this is the right treatment for a person may be that you are trading one substance for another, but that's not the case. That's not how we have to look at it. It is an individualized approach to treatment, and that way we have to create a treatment plan that works for that person.
I'm glad you talked about that stigma, because not all facilities offer this medication-assisted treatment. You were able to talk about the differences and how you've been able to see the success stories.
Yes, absolutely. And I just want to speak a little bit about our statistics overall. According to SAMHSA, in the year of 2018, 2 million individuals were addicted to opioid use, okay? And so with MAT, with that success rate, anywhere from 75 to 80% of individuals who actually engage in this form of treatment, they're not relapsing. We also know the benefits of this treatment decreases crime, overdoses, relapses, and it increases treatment compliance and life stability. Patients are able to regain a normal state of mind. They're able to reconnect with their social support systems, and they're able to go about their everyday managing this chronic disease.
I'm really glad you brought up the relapse thing, because I know, when you're dealing with addiction, relapse is sometimes one of the most scary things. And so to hear those statistics, that is really positive news.
Yes, medication-assisted treatment, it is harm reduction. We look at the individual as a person, of course, and they're managing and working to live a life of recovery and free of drug use.
And be able to go on with their lives in a healthy way.
Absolutely.
Give us an idea, too, because I know we're kind of doing the overall picture of the medication-assisted treatment, but I know there are different types, mostly for opioids that we touched on, but also alcohol abuse, too, right?
Yes, absolutely. So at Cove Behavioral Health, we offer a variety of medications for opioid use, alcohol, as you mentioned, as well as psychiatric diagnosis. For opioid use disorder, we typically prescribe methadone, buprenorphine, Suboxone, Sublocade, and Vivitrol. For alcohol, we prescribe Vivitrol. And we have other medications for any psychiatric disorder that an individual may be experiencing at that time. What we know is these medications are highly, highly effective in treating the individual and allowing them to go about their everyday lives and work and take care of their children and just be active within our community.
I'm really glad to hear you say, too, of course, this is all administered from the physicians that are on staff, which is the big component,
Absolutely. The medication is FDA approved, it is safe, and as you said, it's under the care of a medical professional at all times.
And I'm so glad you brought up, again, the statistics you have. And, of course, we want to make sure, and since we are discussing this important topic, if you, your family member, someone you love, is struggling, there's the information so you can get in touch with Cove Behavioral Health today. There's the phone number and website. And, again, Erica, I'm so glad you were with us today to talk about this important message.
Thank you so much for having me.